Okay. Thanks for helping me with that. Tell me when you're good. All right, good morning. All right, everybody. I'm glad you got your food. You can continue to eat, but for the sake of time, we're going to go ahead and get started. I just want to introduce our three speakers this morning. We've got Daniel Chang, Kevin Barber, and Justin Cave, and I'm going to let them tell a little bit about themselves and just what they've been doing through their nonprofit, and I think this will be really encouraging for you guys and challenging. So without further ado, it's all you.
Thanks, Matt. This is exciting to be here. I spoke, I think it was 2015. I think my topic was rethinking what it means to be a Christian ophthalmologist. And I'm still thinking about it. I've learned a few things, so hopefully we can share and go through some of that together. I'm Daniel Chang. I'm in private practice up in Bakersfield, California. And I guess we'll just, hopefully this will reach.
Good morning, everyone. I'm Kevin Barber, and I am in private practice in Central Florida.
Good morning, everyone. My name is Justin Cave, and I am in charge of a sustainable nonprofit organization in Bakersfield, California. I'm humbled to be here. Thank you.
Okay, so I think we hopefully have the corded mic thing worked out here. The, when I spoke several years ago, I actually led with Psalm 139. I appreciate the prayer where we prayed Psalm 139. I'll just read the first 6 verses here. It says, Lord, you have seen what is in my heart. You know all about me. You know when I sit down and when I get up. You know what I'm thinking, even though you are far away. You know when I go out to work and when I come back home. You know exactly how I live. Lord, even before I speak a word, you know all about it. You are all around me. You are behind me and in front of me. You hold me in your power. I'm amazed at how well you know me. It's more than I can understand. One of the things that we go through, and we're going to talk about providing eye care or serving the underserved in the U.S. and abroad, is there's always a tension and a balance, particularly amongst us as ophthalmologists, people in industry. We're high-achieving people. Is how do we balance, the James 2, the faith and works, right? Sometimes we want to do things, we want to serve God, but maybe we don't. I think most of us fall on we do a lot of stuff. How is this related to our faith, right? Is this related to our practicing in church or our faith communities, or what does that look like? So just kind of balancing that struggle. And, my brother and I started a nonprofit. We brought Justin aboard 7 or 8 years ago. And kind of going through that journey is the name of our nonprofit's Advanced Center for Eye Care. So there's no reference to our faith specifically in the name, but yeah, that's one of our avenues of carrying out, God's great commission for us. So we're going to share a little bit about kind of our history, just a short little testimonies, I suppose, and then we'll just kind of open it up, as we discuss, because we know there's people here with experience locally and internationally that far exceeds certainly my own and a number of our experiences. But I think together, hopefully, we can gain some insight in terms of how we can live and serve Christ through what we do. So I guess I'll start. I moved to Bakersfield about 10 years ago. I joined my brother in practice, and one of the things that we were struggling with was Medi-Cal, or the Medicaid population, right? You have the patients come in, they bring their home family, they don't speak the language, they don't do what you say, they don't come when they're supposed to, and then you have patients next to them. We do a lot of aesthetics and refractive IOLs and LASIK and things like that, who are hoping to get them to pay thousands of dollars of cash for a procedure. And so how do we serve this community? And a lot of doctors in the U.S. struggle with that same question, and my brother's like, hey, let's start a nonprofit. I'm like, what does that mean? He's like, I don't know, so let's just do it. So we talked to some friends who had a foundation, and we started that, and we incorporated, and the first thing we did, it's like, we need to raise some money. So we did this fundraiser. We had, and Justin wasn't even there, we had probably a couple hundred people attend. It seemed like it was really cool. And at the end of the day, we made about, I think it was $1,300 from the fundraiser. It's like, I could have written a check for that, for all the work we put in. So, starting a nonprofit, we had a lot of our friends who are doctors, and we kind of looked around each other, had a bunch of great ideas, but we didn't know how to execute until my brother found Justin. He was finishing up at Cal State Bakersfield in a graduate program. And I think my brother, the way the story goes is he recruited Justin and says, I don't have any money to pay you, but your job is to find your own salary for the next 3 months, and then there's your job. And Justin's like, sure, I'll sign up. So that's the beauty of education. And then about a week into it, he got an offer from a prominent nonprofit in the area for a grant writing job. And then my brother sold him again on the vision of what we could potentially do. And thankfully, he turned that down. So that was 2012. And I think I shared our nonprofit has an annual budget of approximately $3 million for this year. So it's not using money to judge our success, but it is an indication of the breadth of what we've been able to do and what we're doing. And the neat thing about nonprofit, and the first thing I tell folks when I tell people about a nonprofit does not equal free. And because if we had a free clinic, it would not be very sustainable, and we would not see the thousands of people and do the surgeries that we're doing. So one of the challenges is figuring out in a population that money isn't one of their strengths, is how do we create an environment or a clinic or a project or whatever we're doing in a sustainable fashion. Because ultimately our ability to help people is going to extend from our ability to maintain and sustain that organization. So that's kind of what we've learned, and part of what we're trying to do. We started a branch of ACE, or an associated nonprofit called Advanced Center for Eyecare Global, or ACE Global, and we want to try to share some of the ideas that we've learned from our local nonprofit and try to do that in other parts of the world. It's going to be different equations, different communities, different sustainability models. But what made us succeed is not the doctors. We had a bunch of doctors sitting around with our nonprofit. It really went nowhere, but until we had an administrator who had the ability to organize the organization and develop it. So that's kind of a little longer intro than in the plan, but.
So just the 2-minute background on me, I'd like to mention that the resident and fellow scholarship that Matt mentioned, Daniel and I were recipients of that. We were in residency together, and I don't remember if we were just trying to get away from being on call that weekend or what, but we took advantage of it. It worked out well because we're still here. So it's nice to now be on the end where we can contribute to that and keep that legacy going. My hope for this morning is that we can just get some open discussion. There's a lot of experience here in this room. I think we all as Christians and as ophthalmologists or those involved in the ophthalmic community have a desire to serve those who are disadvantaged, right? That's what Jesus did. We all, I think, acknowledge that. And how can we be most effective? And when I was reflecting back on my own kind of experience, I did my first short-term mission trip 25 years ago, and got really involved with MMI and with many of you here in the room, and it just transformed my professional development. But one of the things that I was reflecting on is how when I first started, it was motivated out of compassion, right? You have a skill that you can help somebody, so you go down and you help as many people as you can in that 1 or 2 weeks that you have. But as the years went by, I was left with some angst or some dissatisfaction, because as many of you who've done this know, you leave and there's a long line of people you never get to. And you start to take a step back and look at how big this problem is. And so I noticed that there was almost a continuum of compassion and justice. And I started to focus on more of the justice of God. And we all in this room possess the ability to take care of those who are visually impaired. And so there's a sense of injustice when there's 260 million people that are visually impaired in this world, right? So it really has challenged me. How can we be more effective? How can we create legacies of long-term sustainable care? Whereas when I started, it was just, how many surgeries can I get done this week? Maybe that was 50, maybe I could get up to 75, maybe I could get up to 100. And then you realize, wow, but look at the millions you left behind. And so just starting to think about the problem from a different perspective. And so that's where I am on my journey. And it was really just the hand of God being reconnected with Daniel, because Daniel and Justin have had this very successful run with their domestic ACE. And then as they decided that they would like to take this model globally, Daniel said, well, gosh, I haven't done much globally. And he remembered that I was always going on these mission trips through residency. So he called me and I said, I've been wanting to do the same thing. I've been wanting to learn how to build sustainable centers that will be there for the long term, not the short term. I think that that's the only way we can really chip away at the backlog of blindness. And so it's been a beautiful thing. So I'm still learning from these guys because they've been so successful in how to do the financial models. And I learned that I never thought about this problem from a financial point of view. You get a bunch of donated supplies, most of us can afford our plane ticket. We go down there and we do it. But what I'm learning is there's a huge element of the, an economic thing that sometimes that we as ophthalmologists, we just don't look at because we're too busy looking through a microscope, right? And so I'm on this very intensive learning process of there is an economy of poverty, and sometimes we can upset or damage that fragile economy if we're not careful. And if we have time, I can share some stories about that. But these guys have really dug into that and have figured out how we can make it sustainable and how we can go from charitable to sustainable. And as we do that, that's the only way I think we're going to make that long-term difference. So I'll turn it over to you, Justin.
Oh, thanks. Thanks, Kevin. Thanks, Daniel. But my name is Justin Cave, and I started this journey along with the Changs 8 years ago. And I started it with a borrowed laptop and a desk that I bought off Craigslist. I had really no idea what I was walking into in a lot of ways. They gave me this piece of paper and they said, okay, now here's the clinic days and let's go help. And I said, okay, well, where's my office? Well, that's where you've got to figure that out. And I said, okay, well, let me go to Craigslist. So I immediately went there, got a desk, and borrowed some space out of their private practice to get this going. From there, we started seeing, 10 patients a day. And currently, we have 3 ophthalmologists that are with us part-time and 5 optometrists, and we see over 100 patients a day, just in 8 years. So that's truly a testament to the need. Where we live has 42% of the population who is underserved. So these folks don't have the ability to go to the eye doctor. We have a shortage of providers in our area, and so a lot of times doctors don't take Medi-Cal because you're reimbursed pennies on the dollar, and you cannot sustain a practice like that. And so that's why ACE was formed. A lot of times people come in and they're super grateful for the service. They have stellar surgeons that they get to engage with, and they have a great place to be able to get their eye care taken care of. Next, I think that it's important to talk about, where ACE is going. And with our growth in our sustainable models, we've been able to partner with great, huge organizations called OneSight. So for many of you who may or may not know, but OneSight is Luxottica's charitable partner. And they have built sustainable centers all over the world and all over the US. Once we became involved with them, it was through charitable clinics. They came to our area and they started giving eye care, free eye care, so free vision exams and glasses to the school-age children. And from there, we started serving people, or children, from 90 kids a day. Then it went to over 2,300 over the course of 7 years. From there, we identified that school-age children needed a lot of help, that their parents were neglecting them, that they weren't getting the eye care that they needed. So we developed school-based vision centers in the school districts, and that was with the help of Luxottica. So now we have an optometrist in the schools a couple of days a week who provide eye care in the school's wellness centers for children. And that helped us get to where we were. With Luxottica and with Capital Partners, it catapulted us to another level. Those are the dynamics that exist with partnerships. And with our model, we utilize Medicaid as a reimbursement for folks. But as you all know, that's not enough. So we have to have some sort of built-in sustainability as well. And that comes from grants, donations, and private events. With that, we're able to serve the poor.
I think what Justin didn't say, the partnership with OneSight started, 6 or 7 years ago? And what they do is they have a converted RV, so the kids come in, they get their eye exam, we get community optometrists to volunteer, They grind the glasses and they get them in an hour, about an hour, probably longer than that. But the first year, it was a one-day camp, and we saw 90 kids. And then 5 years later, it was a week-long camp with 2,300 kids in a week. So, the idea was they found that ACE was a good partner to work with, and then they started giving us sizable grants that have totaled over $1 million to start these school-based clinics. So the idea is a kid gets a pair of glasses, sits on them the week later, and they have to wait till the next year to get their glasses. So if we can maintain and be a presence in the school system, then we're able to do that. So that's a charitable converted to a sustainable model. And actually one site is kind of helped us envision that. And actually Justin came to me last summer. He says, I want to take ACE globally. I'm like, are you nuts? And it's like, why do you want to do that? It's like, but Justin usually has a good argument, a good plan, and has usually already started to execute it when he comes to me. So he said, one site basically does these same camps, which some of my optometrists have been to globally. They go to India, Thailand, wherever. And the problem with just giving out glasses is half the patients in these countries who come to these camps have cataracts. So they just simply have to turn them away. So they say, hey, based on their experience with us as an organization, knowing that we're a medical surgical as well, is can we do cataracts in the third world? And I'm like, I've been to El Salvador. I put in some IC8s for research, but that's my only experience. But I know Kevin, and that's how we kind of hooked up. So it really gave us that insight of, trying to create that model. I think they have the one way of doing it of you test out a site, and the key, I think, of what one site did with us, they said, hey, the people on the ground, the Advanced Center for Eye Care is reliable. We have Justin here, is a stable organization where they can invest and pour significant monies to us to grow their vision of a sustainable eye clinic for kids. And so what we're hoping to do is to do a similar thing, is identifying places in the third world where we can help. Many of you probably know Kevin Waltz. He does a lot in Central America, Honduras, El Salvador. If you want a first-in-man anything device, go to Kevin, he'll bring it to Central America, and you get to figure out what your device did in the eye. And that's been his model, is using research funding from industry to help a number of practices in Central America. And he's shared with us at Academy last year some of his experiences of really identifying the right partner. Because if you want to invest in somebody locally, you want to make sure that they're reliable and not just running away with your money. And he had some bad experiences, and it was advising us to want to make sure that you can trust the people that you're working with. So we've had some interesting partnerships, and I was hoping to cue Justin in terms of, it's neat, Matt mentioned Nathan Henson's on the board. We've actually had some experience with him, and I'll let Justin share about that.
Yeah, with this journey, taking ACE globally, Kevin recommended that I go down to Peru, to Cusco, where close to Machu Picchu is, where they found this Christian ophthalmologist who's doing some fantastic work, and it was super amazing. I mean, Nathan it gives me goosebumps to even talk about him. He literally moved his family down there, and he has changed his whole life to do God's work. And it's super humbling to watch, and it's super amazing to be a part of. This man is truly a gem. And what he has built down there for these folks is truly incredible. And so we're really hoping that one site can be a part of that as well. And in October, we're planning on going down there and helping Nathan do some surgery. And we're really looking at helping create a sustainable center outside of Cusco with ACE Global. So that way he can reach out to the folks that are not necessarily in the city, but they can provide vision care for those in the outskirts, and then bring them in if they need any help if they need any medical care. And so that's something that Nathan is looking into, and that we're looking into with him. But the man is amazing. The work that he's done and moving his family out there to serve the poor is just incredible.
I think just listening to the talk, I guess the take-home message that keeps reverberating in my mind is that all of you who takes part in short-term international eye trips here? A good number. All right. Who's going to? I just want to challenge us all to, as we're involved there, that we're thinking about this from a long-term and a sustainable thing, that our efforts are not just for that 1 week or that 2 weeks, that we're looking for that long-term legacy. And the two I guess, pearls that have kind of been mentioned already, that I would just like to leave with you and would love to hear, your feedback on, is one, really looking for that national partner. So if you're involved with a specific country, it's finding that person that shares that same vision. What we've been doing, one of our initiatives with ACE Global, is we are partnering and working with some of the residency programs in the Dominican and Honduras, hopefully in Peru. And you get to know those residents. You go down, and instead of going down and doing as many surgeries in a camp, go down and sit at the scope next to a resident. And over a week, you really get to know their character pretty well. And you find those residents who have that same desire to serve the poor, but they also have to feed their families, right? So sometimes we can just help them develop a really successful private practice. I mean, the reason that Daniel and I can spend time doing the nonprofit stuff is because we have successful private practices, and that affords us the luxury of going internationally or working with ACE. So the same is true there. If we can go and help some of these young residents develop sustainable, good, healthy, top-notch practices, which then help them cross-subsidize the cost of the poor that's all around them. Isn't that kind of what we do? If you have someone really poor that's referred to you, don't you take care of them? You don't send them out the door, right? So if we can help them do the same thing, that's so much more effective than the 1 week that we can spend down there. So maybe reevaluating how we spend our time there and really searching for those national partners. So we've found a couple of these young residents, and we're setting up programs where they come and they'll spend a week or two with my practice. And again, it's just another opportunity to really mentor and disciple them and get to know them, and then we'll go down and spend time with them in their training, and then as they go off back to their home country to set up whatever practice arrangements, we help them with that. Whether that's sometimes they have a real difficult time setting up a practice. You guys know how expensive that is. The stuff we use is not cheap. So helping with small business loans, things like that, and over time, that makes a really a long-term effect, and then you can move on to the next thing. And I think when we look at Jesus, isn't that what he did? He told us, hey, I'm going to teach you to do it, and you're going to go do it, and I'm out of here. So I think that's the model that's been there for us. The other thing I would say is, again, just learning to understand the economic models. We have this mentality, or I had this mentality, that everything's free. Again, I take donated stuff, but again, that's not long-term and sustainable. And our view might be different than the view we go to international communities. We come from a place of affluence. Poverty doesn't affect us like it affects them. So there's a different economy there. There's a different mindset there. So we have to learn that, and sometimes we can disrupt that. I'll tell this story, and I've really struggled whether I should, but something really smacked me in the face hard this year. So I've been going to a country regularly, and I usually would go on a short-term trip, and we'd usually do our own thing, do as many cases as we could, and come home. And we did a lot of good. But through the Christian Eye Network, I was connected with a surgeon, an ophthalmologist, who is a national there in this country, and he was asking for help. So I started a dialogue with him and said, yeah, I think this guy could really use some help, so I'm going to go help him. And so I went down, and we did cataract surgery together, and he had just moved to a new area where there's no ophthalmologist in his entire city. So he's got a large population, he's the only guy, but he needs help. So we started helping with equipment. And what he told me is, he said, hey, I want to learn phaco. And I said, well, why do you want to learn phaco? I said, you're an excellent M6 surgeon. This guy can do a 5-minute M6, and he's really good. And he said, the reason I want to learn phaco is that the people in my community that can pay for it, they have phones, they have Google, they Google cataract surgery and realize that phaco's, the way to go. So they leave here and they go there to have somebody do their phaco. So he said, I can't take care of the poor when the only people I have as patients are the poor that can't pay. I need people to help feed my family and so that I can pay my staff. So I want to learn phaco so I can keep those people in my community here. So I said, great, I'm really good at phaco. I'm not so good at M6. I can teach you that. So we got him a phaco machine, and I'm feeling good, and we set it up. And he was supposed to have between 30 and 50 patients for a week-long project for us to go down, and I was going to sit next to him at the scope and teach him how to do phaco and try to get him proficient. I got there, and we only had 9 patients. So I was pretty disappointed. He was pretty disappointed. And when we sat down to talk about it, I said, what happened? He said, well, I had all these patients here, but 2 weeks ago, this American team came in, and they did free surgery. So he said, my middle-class patients that could afford phaco came and got their money back and left and went and got free surgery by the Americans. And then they left, and then I had to see their post-ops. And when I saw their post-ops, the patients said, well, I didn't pay for my surgery. Why should I pay for my post-op care? Man, that hit me hard. And I know that those American surgeons that came down had the best of intentions. Nobody would go down intentionally to hurt, anybody in that setting, right? But they just weren't aware. And it made me realize, oh, wow, I've really had my head stuck in the sand for a long time, because I started to think of all the places I visited, did I do the same thing? I mean, imagine if your community, if some outsider came in and offered free cataract surgery and then left. So there's already this very fragile economy, and we just disrupted it. And so now this guy couldn't pay his staff that week. I wasn't able to teach him phaco. And so he also told me some other things. He said, when American teams come down here and they don't partner with me, what that tells my community is that I'm not trustworthy. Therefore, it undermines his ability to be successful, even though he's going to be there every day. It further undermined his reputation by the fact that the patients didn't understand why they were being charged for their post-op care, even though he didn't do the surgery. So he said, but when you come down here with me, and we go out in the community, and we do free screenings, and we do free surgery, but we do charge the people that can pay, he said, that builds up my reputation. That says, hey, the Americans who were perceived as, the best trained and the best experienced as the experts, they support me, so therefore it builds up his reputation. I never saw it from that perspective before. Maybe some of you have that are further along this journey, but I wanted to share that because it really challenged me. And so I guess I just want to leave you with that, is that when you're going to be involved, really try hard to make those national connections. Those relationships can get dirty sometimes. They can be difficult. You're dealing with someone from a different language, a different culture, comes from a different economy, so there's lots of issues. But man, we really have to, we can't avoid that. And I think we can have much greater long-term effect if we're willing to take that risk. So I hope that helps some of you. I'm still struggling, and if any of you have advice on that, I'm all ears, because I've really been challenged by that experience.
No, that was very eye-opening. I think at the end of the day, and it's approaching 8 o'clock, we'll try to wrap up and just have discussions and questions. It's about relationships, right? I mean, God as a Trinity is he's a relational being, right? He created us for relationships. And I think ultimately through our life, we do a lot of things, but the cool thing is we get to do it with people. And that's been one of the fun things for me in this journey, is reuniting with Kevin and doing things together. I hadn't seen him in years since residency, and doing a meaningful project together. And that's what brings us close to each other. Justin, I've gotten to know over the last several years, and going through ups and downs, and in the organization and even personally, and being there and trying to show Christ in Justin's life. And ultimately, if we're going to work, whether down the street or even in our own clinic, it's about the last year or two that I realized, and we realized as our practices, it was always patient first, but now we're trying to put our employees first. And I like to think with my managers especially this is an opportunity, and all of my staff, to grow professionally, grow personally, and for those who are interested, to grow spiritually. And if you guys have read the book Good to Great, this idea of a hedgehog concept and at the core of what you want to do, mine used to be the surgical correction of vision, right? You got to be, drives your financial engine, you got to love doing it, you got to be one of the best in the world at. I realized I didn't quite fit what we were doing. So, and like GE, their goal is to develop managers, and I think that's kind of what our hedgehog concept is becoming, is developing people. And at the end of the day, someone who works with me for a year or 30 years, I want them to say at the end of their tenure or whatever with me as a practice professionally, it's like, I've grown as a person, or I've grown in my faith because I've been, working together. And at the end of the day, when we just cure individual patients, it's great to, be a light to them, and it's fun. But our staff are the people who see us day in and day out. And that's our community. We spend more time most of us spend more time in our practices than we do at church and with our families, right? So these are our families, and those are the people we're going to invest in. And ultimately, if we're going to partner and do things in another geography or another hemisphere, we're going to build relationships. So it's about the people on the ground. You know, ACE didn't happen. If we didn't have Justin, we'd still be a bunch of docs and nurses sitting around a desk figuring out what we're going to do, and it'd be like a little corner of our clinic. So again, it's building those relationships, investing in those. It's messy, takes time, it's not easy, but in the day, that's what Christ did for us. He came here, became flesh, became like us to reunite us with him. So
I just want to add that you look at these numbers and they're impressive. You look at your own private practices and you think about how many people you've served that are underserved and or the poor. There's a good handful, maybe a couple hundred. Last year we saw over 20,000 people who were underserved. And so really moving to the sustainable models is really something that I challenge all of you to take a look at, whether it's getting involved to train surgeons, whether it's getting involved to, implement in your own community, whether it's getting involved via donation, those other types of means. It's really, I think, the key to making sure that we can cure the world, and solve this vision crisis that are out there. But the three of us can just sit here and talk about our experiences. We also want to hear what you all have done and what your experiences are out there as well. So I think at this time we'd like to turn it over to you all to try to get some question and answers going, and also talk about some of your experiences that you may have had.
I go down to a country in Central America and had the same experience that Kevin's comment was about teaching them Phaco, and I've been down there for 20 years, and he said to me this last year that him learning Phaco turned out to be the biggest gift given to him for that reason, because he has this whole poverty side, and he said, I'm able to fund it out of that. He has two separate entrances in his building, and he's really designed it well, and I really had no clue of that at the time. I just knew I was a horrible M6 surgeon, and I knew how to do Phaco, and so I could do that when I went down, and so I did that, and finally he said he wanted to learn it, so we went through that process, and he learned it. The second thing that helped him a ton was to give him certificates in English. So whenever he said, oh look, you came down, you taught me CK. When CK was big, I went down, I learned in his patients, and then he said, now you taught me how to do CK, I need a certificate. And so he said, I don't care what hospital it comes from, it just needs to be a certificate. So that certificate's up on his wall in English, and that helped him gain credibility. Yeah. And I had no clue of that until years later after the third and fourth certificate. Yeah. So that's something you might think about. The last thing, Mike, something we really struggle with that you didn't really speak to is the definition of sustainability, because it sounds like your sustainability because somebody's donating, and then what happens if the donor goes away? But maybe you're doing it without donations. I didn't catch that.
Yes. So our model is obviously looking at reimbursements as well. So through Medicaid, we get reimbursements. In our school-based vision centers, there's no out-of-pocket cost for any of the services we do, but we do charge their insurance. And people that come in, we do charge their insurance. We have grant programs through our nonprofit organization that if they have some sort of a spend down with Medi-Cal or something like that, that they can apply for a grant. But we do collect those funds as well, because that's the only way that we are going to stay sustainable, is if we have that insurance reimbursement. And all of you know that Medicaid is, Medi-Cal is paying us pennies. So we have to have something that offsets that. But the real sustainability comes from those Medicaid reimbursements.
yeah, I think the way you say it kind of came out earlier is that the grants sustain it. So the grants kind of help boost things, especially early on. We had a $140,000 equipment grant from one of the health systems. I had better equipment in my nonprofit than I did in my private practice for a while. But the idea is that the grants help, and they come from different directions. Some are individual, some are healthcare systems. So it's kind of a boost, but the goal is to have the continual seeing patients. In the U.S., we're able to do that and kind of supplement the Medi-Cal payment. In other countries, we may not have that at all.
You're bringing up a great point, and that's, I think, one of the biggest challenges that we've probably been, as a community, fairly guilty of not really thinking about and addressing. And just like with our own practices, right, we're financially diversified. You have self-pay patients that pay for elective procedures. You have your straight Medicare or Medicaid patients. You have maybe an optical, maybe a surgery center. We're diversified, right? There's multiple ways of income coming in to make us a sustainable business. The exact same thing has to be true in our missions work, right? It can't just be free and be sustainable. So part of that is what I've learned is the sliding scale. So in some of the countries we work with, people will come up with that scale where a patient will fill out a little questionnaire. What's your home made out of? Do you own your home or do you rent it? Do you sleep on the floor? Do you sleep on a bed? Do you own a car? What's your education level? How many children do you have? Do they go to school? They fill out this 5-minute questionnaire. There's a point system, and then that pretty clearly gives you kind of a quick socioeconomic stratification of what this patient really can afford, so that you're not giving free care to people who can't afford things. Or you're not charging somebody who truly has, nothing. It's hard for us, right? Because that's not our culture. So there are strategies that can be done, but you need that national partner to help sort that out, because we don't have that information. There's other ideas. Nathan Henson, I remember a lot of you probably contributed to this, but he just recently acquired the ability to do LASIK in Cusco, Peru. When he first called me about that, I'm like, are you a missionary doctor or a LASIK doctor? I mean, what are you trying to do? But the revenue, but what he realized is there's an emerging middle class in Cusco because of all the tourism. Everybody wants to go see Machu Picchu. So the hotel owners, the restaurant owners, they now have some expendable income and they want LASIK. And he was having to refer them all to Lima, which is a flight away. So he now has a laser that he plans on making open access, and the revenue that he generates from that will probably completely support his orphanage. His eye clinic is actually self-sustaining just from patients paying and the revenue, the optical that he has. But the revenue that's going to come in from his LASIK program is going to help pay for the orphanage, is going to help pay for the growth and the expansion. Another idea I just heard about that Orbis uses, if you have someone come in who's bilaterally blind, well, they probably can't pay for anything. They're blind, they can't work. So you do one eye, but you give them the dignity of saying, hey, if you want the other eye done, you got to work for it. You have to go out into the community and tell 5 other blind people what your experience was, how you were blind. Now you can see, because there's a lot of cultural barriers. They don't trust doctors, whatever, and they bring them in. And once they brought the 5th blind person in, then they get their other eye done. Okay, so now you've stimulated economy, you've given dignity, and they still have to pay their 2 pennies for their surgery or something like that. So thinking in these ways, instead of my model for 10 plus years was, it's free. Get donations, give it for free. Eventually, just as you were alluding to, those donations will dry up, right? So really looking for the sustainable economic ways.
And I think that's with all of us, right, in this room, and that's all of us within the nation, is, like Daniel said, nonprofit doesn't necessarily equal free. If we're going to give access and we're going to cure the world of blindness, we have to create a system where there is some sort of sustainable solution, and that's through insurance payments, and that's also through people supplementing the costs. I'm not saying they're paying full costs. I'm saying they're help supplementing the costs. So if they're paying $100 for a cataract surgery, right? You all know that's a really expensive surgery, but they're contributing to something. And that's what's super important, is creating that access and that ease of being able to have someone, have value in the service that they're getting as well, in order to keep it going.
Any other questions at all? Yes, Ron.
Quick comment. Some years ago, I was part of president of the organization that Bill Conrad had started. Again, that was an NGO going to China, doing small incision cataract surgery and administering support. That's not really welcome anymore in China. Now they're looking for sustainable businesses, models, and even the government are not. NGOs are kind of being blocked, so the whole dynamic is changing now, where you really have to make it like a sustainable business model.
Right.
And so a lot of us think, well, we want to do a charity, we don't want to do a business. But, you know, charities aren't even relevant because I think the government see them as just sort of a temporary, unpredictable thing.
Yeah.
And it can be disruptive to the economies and such, and the businesses are much more relevant.
A patient who has their vision restored through a charity or through a for-profit business both have their vision restored. The Justin, actually, I want to share, got in late last night. He was in Washington D.C. for a National Geographic panel with One Sight. So I asked him to remember me when he's rich and famous. But I think you met someone. You were talking about China and some of the experience.
Yeah, so it's interesting. I was sitting next to a panelist who is working for Stanford that actually helped develop these vision centers with One Sight in China. And I believe there's like 16 of them now. And that's exactly what the country has moved to, is creating these sustainable centers in these areas that are in rural China that can help people get access to what they need. And a part of ACE Global's mission is to partner with those vision centers, because we all know that you can have cataracts and put a pair of glasses on and good luck. You know, that's going to do nothing for you. But having an ophthalmologist partner with these vision centers and be able to do the medical and surgical work that's also involved is going to be critical in making these things happen. So the next time we sit up here, we hope to tell you about our adventures in China.
Real quick, just 2 books, if this kind of stuff really piques your interest, that I have found just really challenging. One is Toxic Charity. That's probably the most popular. It's a quick read. It gives a lot of these examples. It helps us just, again, see a different perspective when we're trying to go down and help, how sometimes we can cause some collateral damage if we're not aware. And the other one's called Walking with the Poor. It's Toxic Charity on steroids. It really gets into the economy of poverty and sustainability. So if this stuff interests you, two really good reads. I know it's getting close to time. Are there any other comments or questions? Yeah.
Quick question. How does ACE Global go about making local connections in, say, a new country that you guys want to expand to? Where do you find? Who do you call? How do you start that?
Yeah, that's a great question. I think with groups like this, you know, as well, where you have a database that's being collected where, you know, other ophthalmologists within other countries, we can connect that way. We have great partners with One Sight. You all know us up here. I'll give you my cards. We can connect you, you know, with different places and different people that are of like mind that, you know, want to make a difference and do this type of work.
I would add prayer to that.
Yeah, we're kind of new. We don't say we want to go to this country. We say we've met this person, let's work with them, and they happen to be in this country. So again, we try to focus on the relationships and go from there. So why don't we close? I'll close with some prayer, and then we can just feel free to chat and head to where we need to go. Father, thank you for this morning. Thank you that we can just be together with brothers and sisters and share about what you're doing in our lives and locally and around the world. And just thank you for the burden that you've given us. Thank you for the resources you've given us, and ultimately given us your Son, and the hope that we have in you. I just pray that you bless the conversations here, the rest of the meeting that we have, Lord, and we just bring honor to you everywhere we are. In Christ's name, amen.